Have you ever wondered how a simple health myth can turn into widespread misinformation, causing confusion and potentially dangerous health decisions? In the digital age, health misinformation has reached staggering heights, becoming a pervasive and highly consequential issue, specifically on social media platforms. These virtual arenas, where information can be shared and consumed at an alarming speed, have become the perfect breeding ground for health myths and fabricated claims. The ease of sharing information and the lack of stringent vetting processes have created an environment that is ripe for the rapid spread of false information. Diseases, treatments, vaccines, and various health-related issues are often the primary targets of this misinformation. Misinformation about these topics spreads like wildfire, reaching countless individuals across the globe in the blink of an eye, causing substantial public confusion and panic. This issue isn't merely a case of a few misconstrued facts or some isolated incident's miscommunication. It's a widespread problem that requires serious attention and prompt action. A systematic and comprehensive review on the prevalence of health misinformation on social media paints a rather daunting picture of the current scenario. The review encompassed 69 studies and covered a wide spectrum of health topics. The most frequently encountered categories of health misinformation were related to vaccines, drugs or smoking, non-communicable diseases, pandemics, eating disorders, and different forms of medical treatments. What makes this particularly alarming, what sets off the alarm bells, is the overwhelming volume of this misinformation. For instance, in studies related to smoking products and drugs, health misinformation was found to be as prevalent as an astounding 87%. Misinformation about vaccines, especially the human papillomavirus vaccine, was also rampant and widespread. Platforms like Twitter, which enable the rapid exchange of ideas and information, act as the perfect vessels for this misinformation, quickly blurring the line between fact and fiction, between what's real and what's not. And let's not forget that the consequences of this misinformation are very real, very tangible, and can be significantly dangerous. For instance, during the COVID-19 pandemic, misinformation led to people refusing vaccines, denying the efficacy of public health measures, and resorting to unproven and potentially harmful treatments. This grim reality underscores the urgent need to address the rise of health misinformation and take proactive steps to enhance the quality of information available online. Addressing this issue is a twofold process. It involves making an effort to fact-check the information we consume and share, and also promoting awareness about the existence and potential risks of health misinformation. Remember, in the fight against health misinformation, awareness is our strongest weapon. We all have a part to play in this battle, and together, we can decide the course of our collective health narrative. Stay informed, stay cautious, and stay vigilant. So, let's pledge to arm ourselves against health misinformation, to question, to verify, and to disseminate responsibly. Thank you for joining us in Essential Conversation about health misinformation. We hope you found this information valuable. If you like this video, make sure to hit the like button and subscribe for more insightful content, because the first step in combating health misinformation is awareness. Now that we've seen how health misinformation spreads, let's delve into its impact on society. Health misinformation, particularly when it disseminates rapidly across social networks, can have profound implications on the behaviors and attitudes of the public towards health matters. It's a phenomenon that isn't new, but its effects have been amplified in the digital age, and the results can be far-reaching and disastrous. One of the most striking instances of this is the ongoing COVID-19 pandemic. This global health crisis, which has affected millions of people worldwide, has been further complicated by a deluge of misinformation. Misinformation during this pivotal period has led to a significant number of individuals declining to receive the life-saving vaccines. Unfounded claims about the vaccine's safety and effectiveness, circulated widely online, have sown seeds of confusion and fear, leading many to reject this essential protective measure. This refusal to get vaccinated has placed not only these individuals' health in jeopardy, but also the well-being of others in their community. The ripple effects of such decisions are manifold, and the potential consequences are severe. It has created pockets of vulnerability that the virus can exploit, prolonging the pandemic and putting additional strain on healthcare systems. Health misinformation has also led to the undermining of other public health measures designed to curb the spread of the virus. These measures, such as mask wearing and social distancing, are critical to controlling the virus's spread. Nevertheless, they've been undermined by false information and conspiracy theories, thereby exacerbating the public health crisis. These distortions of truth have fueled the virus's spread, making it harder for health experts and authorities to manage the situation effectively. The situation takes a turn for the worse when individuals, swayed by health misinformation, begin to embrace unproven treatments. The internet is replete with unfounded claims about miracle cures and quick fixes for COVID-19. These false assertions divert people from seeking appropriate medical assistance, potentially leading to harmful health decisions that could aggravate their conditions or even lead to unnecessary deaths. Every time we dissect these instances, we discover a common thread. Health misinformation, left unchecked, creates confusion, prompts poor health decisions, and presents danger to public health. This ripple effect begins with a single false claim, and like a snowball rolling downhill, it gathers momentum, reaching and impacting an entire community, a city, or even a whole country. In every corner of the globe, the impact of health misinformation can be debilitating. It's a worldwide problem that calls for our attention, our understanding, and our concerted efforts to fight. A collective global response is required to tackle this pervasive issue and ensure the health and safety of all citizens. In our segment, we'll explore the current efforts being made to combat health misinformation and promote accurate, reliable health information. These efforts are critical in turning the tide and equipping people with the knowledge they need to make informed health decisions. Only by doing this can we hope to mitigate the effects of health misinformation and work towards a healthier, more informed world. As we've seen, the impact of health misinformation can be devastating. It's a global issue that requires our attention, our awareness, and our concerted efforts to combat. In the face of this misinformation crisis, what are public health officials and social media platforms doing to protect the public? You may be pondering upon this question. We will delve deep into this topic and break it down for you to better understand the dynamics at work. We're witnessing an impressive, concerted, and complex collaborative approach aimed at countering the rampant spread of health misinformation that's rife in the digital world today. Why is this important? Because the health of our society is at stake, and it's crucial that we get the facts right. On one hand, the public health officials, those frontliners who have been tirelessly working to ensure our health and safety, are once again stepping up to the challenge. They're grabbing the proverbial bull by the horns, and are making radical efforts to improve the quality and credibility of health information that's readily available on the internet. For example, noteworthy institutions like the U.S. Department of Health and Human Services, and the Office of the Surgeon General, have launched groundbreaking initiatives to assemble public opinions and factual data on the impact of health misinformation, particularly during the ongoing pandemic. But this is not just an exercise in understanding the past. It is about learning from our mistakes, about examining the different aspects of how misinformation has affected our society, and about creating strategies to prevent such instances in the future. The data collected will give us a clear picture of how misinformation undermines trust in the healthcare system, impacts the morale of healthcare professionals who have been working round the clock to save lives, and what it means for future public health emergencies. This data will provide the insights needed to develop robust, foolproof strategies to fight misinformation head-on. On the other hand, the social media platforms, which are often the breeding grounds for such misinformation, are showing remarkable responsibility and initiative. They are becoming more stringent with their policies to weed out false or misleading content, playing an indispensable in disseminating accurate health information. They are also proactively educating their users about misinformation techniques, promoting health, science, and media literacy, thereby enabling their users to differentiate between the real and the fake. Global health organizations like the World Health Organization, WHO, are not standing by either. They are doing their part by conducting systematic reviews to understand the effects of infodemics and misinformation on people's health behaviors. This deep understanding is aiding in the design of effective policies and action plans to tackle the issue head-on. But as with any fight, it's not just about the big players. Each one of us has a crucial role in this battle. By working on improving our health literacy, learning about the techniques used to spread misinformation, and being careful about the sources of our information, we can all contribute to slowing the spread of health misinformation. While these efforts are a step in the right direction, there is still much work to be done. It's paramount to remember that the fight against health misinformation is a marathon, not a sprint. As we continue to adapt, learn and grow in this ever-changing digital age, Our strategies to combat health misinformation must similarly grow, adapt, and evolve. Together we can shape a more informed, safer world for us and the generations to come. Technology and social media platforms play a crucial role in the spread of health misinformation. But can they also be part of the solution? Indeed, they can, and they are already making significant progress towards becoming an integral part of the solution. In today's fast-paced digital world, technology and social media platforms have emerged as the primary channels of health information for a vast majority of the population across the globe. While this digital shift has unfortunately led to a rampant spread of health misinformation, there is a flip side to this as well. These very platforms, when used effectively, have the enormous potential to disseminate critical, accurate, and time-sensitive health information on a large. Just envision this scenario for a moment. Recently, a couple of esteemed organizations, namely the U.S. Department of Health and AMP Human Services and the Office of the Surgeon General, issued a request for information (RFI) on misinformation related to the novel coronavirus disease or COVID-19. This landmark initiative sought to garner public comments and compile data on the far-reaching impact of health misinformation during this unprecedented global pandemic. It delved into the role that technology and social media platforms can possibly play in disseminating crucial health information to the masses. The main aim of the RFI was to gather comprehensive information on the prevalence of COVID misinformation on various tech platforms, their existing policies to tackle such misleading content, and, importantly, the sources that are actively spreading this false information. The initiative also sought to unravel the complex dynamics of how such rampant misinformation affected public trust and confidence in the healthcare system at large, the morale of the tireless healthcare workers on the front lines, the serious implications this might have for future public health emergencies. This and several other similar initiatives underscore the growing recognition, and rightly so, of the pivotal role that technology and social media platforms can play in combating health misinformation. By actively seeking data and valuable input from the public and the user community, these platforms can gain deep insights into the mechanics of how misinformation spreads, the demographic cohorts that are most susceptible and affected, and what strategies might be most effective in countering this dangerous trend. Moreover, technology can serve as a powerful ally in the detection and removal of health misinformation. Advanced algorithms powered by artificial intelligence can identify and flag potential misinformation for review by human moderators. Tools for fact-checking can be integrated directly into the functionality of social media platforms, alerting users to potential misinformation and equipping them with accurate information. Of course, these efforts are not without their fair share of challenges. The nature of misinformation is complex and ever-changing, requiring technological solutions to be continuously updated, improved, and made resilient to keep pace with this evolving landscape. Yet, despite these challenges, the potential of technology to combat health misinformation is immense and substantial. It represents a powerful tool in our collective fight against health misinformation. In the end, as technology continues to evolve at a rapid pace, so too must our strategies for combating health misinformation. The fight against health misinformation is far from over, but with the help of technology and social media platforms, we can hope to turn the tide. Looking ahead, what does the future hold for health information and misinformation? As we find ourselves on the brink of a new era in the world of health, there are many complexities and prospects that demand our attention. The vortex of health misinformation, especially prevalent on digital platforms such as social media, appears to be a storm that's showing no signs of diminishing in the foreseeable future. Yet, amidst this chaos, there exists a sliver of optimism. The World Health Organization, as a reputable and recognized entity in the global health sphere, has produced a thought-provoking review on the phenomena of infodemics and the rampant spread of health misinformation. This review offers an insightful glimpse into the potential future trends that we might encounter in the unfolding landscape of health information. The digital revolution has not only transformed our lives but has also given birth to a new strain of health misinformation, the infodemic. The term encapsulates the swift and widespread dissemination of both accurate and misleading health information, which complicates the task of differentiating the factual from the deceptive. As we move forward, it seems plausible that infodemics could become a recurring feature of our digital existence, particularly in the midst of health emergencies. In a world increasingly interconnected via digital technology, the rapid proliferation of information, both true and false, reality we cannot ignore. However, it is important to remember that the same digital mechanisms that facilitate infodemics also have the potential to be leveraged against health misinformation. Indeed, we are already witnessing the genesis of promising initiatives aimed at enhancing the credibility of online health information. As we navigate a world where falsehoods are often just a click away, these initiatives represent a beacon of hope. Such undertakings are expected to gain momentum in the future, as we continue to grapple with the consequences of misinformation. Technology companies, social media giants, and public health bodies are collaborating in this endeavor. The fusion of their collective resources and expertise is resulting in innovative solutions. This includes sophisticated algorithms designed to identify and flag potentially misleading content, as well as digital platforms that prioritize the dissemination of substantiated, evidence-based health information. Yet it is essential to remember that technology isn't a panacea. It's a tool, powerful though it may be, but it cannot replace the importance of critical thinking and public education in combating health misinformation. The future of health information doesn't solely rely on technological advancements. It also depends on fostering an environment that promotes media literacy and encourages the public to critically appraise health information. The importance of individuals adopting an investigative approach to health information cannot be overstated. Cultivating a culture of curiosity and healthy skepticism is vital, wherein people are encouraged to question the source of information, corroborate facts, and learn to spot the red flags of misinformation. Achieving such a goal is, undoubtedly, an ambitious endeavor. It necessitates a collective resolve from all sections of society. We must acknowledge that we each have a part to play in determining the nature of future health information. From policymakers and educators to technology firms and ordinary citizens, we must all contribute to ensuring that the digital arena promotes health rather than jeopardizing it. The future of health information is a shared responsibility. It lies, ultimately, in our hands. It's incumbent upon us to ensure that this future is grounded in truth, rather than tainted by misinformation. Let's strive to create a future that values facts over fallacies. Don't forget to hit the like button and subscribe for more content like this.